So here we have our next topic, which is neuropsychological assessment. Okay, when we have to assess the amount of impairment in behavior or cognitive capacities after brain injury or damage, we use neuropsychological assessment procedures. Okay, like it is used for to assess the amount of impairment. Okay, in impairment in behavior or cognitive capacities after brain injury. We use neuropsychological assessment. Okay, and various neuropsychological tests are employed to make an assessment of different cognitive functions such as learning, memory, discrimination tasks, intelligence, language, perception, decision making, reasoning, etc. The tests are administered, scored, and evaluated, and a complete mental status of the patient is taken. So the neuropsychological assessment include a comprehensive examination of the behavior, psychological and neurological assessment of the patient. So it includes behavioral, psychological, neurological assessment. Okay. The assessment helps to get a clinical picture of the patient with respect to his cognitive strengths as well as any difficulties that may be there in any cognitive or psychological area. These evaluations help in treating the patient with appropriate medical or rehabilitative procedures. Apart from this, the neuropsychological assessment also provide valid information about the kinds of impairments that may result due to brain damage, injury, or trauma, and how to take care of these deficits. Deficits means the problems or the consequences or the any type of negative impact on the patient. Okay, what kind of interventions needed can be planned to help the client cope with the impairments, or how the patient can use other resources to deal with daily life problems. These assessments does not only help to diagnose a problem but also provide valuable information about the prospective treatment plan for the patient. The effectiveness of the treatment procedure is also assessed so that these programs can be developed to benefit other patients too with similar symptoms. Hence, rehabilitative psychologists can be trained in devising intervention programs for elevating or dealing with the cognitive impairments after brain injury, tumor, damage, stroke. So here we take help of the rehabilitative psychologists. Okay, and they helps to improve some areas which are part of the cognitive means which is associated with the memory, thinking, or problem solving skills, which is a part of the brain. And the psychologist gathers important information from the patient about the history of the illness, the occurrence, severity, developmental milestones, genetics, or any other factor that may help in getting a more accurate picture of the patient's problem. Psychologists also use semi-structured interviews to know about the development of the problem. There are various diagnostic tests available for neuropsychological assessments. Few of the common neuropsychological tests used as below. So here I'm gonna state some neuropsychological tests. First is Wechsler Intelligence Scale. Okay, the first version of this intelligence test was known as Wechsler-Bellevue Intelligence Scale. Wechsler-Bellevue Intelligence Scale. Bellevue. I'm gonna write the spelling. This is the spelling, Bellevue scale. Okay, it was published in 1939 by David Wechsler. David Wechsler. to measure intellectual performance of the adults. Okay, these scales have been subsequently been revised for adults and children. The Wechsler Adult Intelligence Scale 3, which is also known as WAIS 3, is administered on adults. It was for adults. Wechsler Intelligence Scale for children 3. Then he stayed Wechsler Intelligence it was WISC 3. This was administered on children between 6 to 16 years. The Wechsler Preschool and Primary Scale of Intelligence, which is Wechsler Preschool and Primary Scale of Intelligence R, is designed for children between 4 to 6.5 years. I hope you can all see this. Okay, so this was the basically the scale which was proposed by the David Wechsler, and it was all passed. It was all part of the test procedures or the neuropsychological tests. The next we have the Halstead Raten neuropsychological test battery. Okay, the battery consists of a set of neuropsychological measures which are used by a trained psychologist or a clinical psychologist. The battery is designed to assess all major cognitive, sensory, expressive, and motor function. The test battery is found to be reliable and very valid for both younger and older age groups. So, in this way, test battery is used younger and older age groups. It was for both. Okay, the third one we have the Luria, Nebraska neuropsychological battery. The Luria, this was the third neuropsychological test. Nebraska neuropsychological battery. Okay. So it is a standardized battery 1986 of neuropsychological tests found to be useful in diagnosing and treatment of brain damage or any brain dysfunction. The test battery is useful for adolescents, adults, and older adults. A separate version of for children between the ages 8 to 12 years of age is also available. The major areas covered in assessment are motor, perceptual, language, which is receptive, speech, expressive, receptive and expressive. Okay. The next we have academic, and the last we have memory and intelligence functioning. And the fourth neuropsychological test is the Ray Austereth complex figure test. Austereth complex figure test. The tests were designed by Ray in 1941. Okay. It is used to assess visual perception and visual memory in brain damaged individual. It is one of the most used tools to assess constructional abilities, and it is also used as a non-verbal memory test. It is also used as a non-verbal memory test. So Australia developed norms for children and adults with age range from 4 to 15 years, and for adults it was 16 to 60 years. Okay, the fifth neuropsychological test is Dallas Kaplan executive function test system. It is a neuropsychological assessment for executive functions like thinking, inhibition, problem solving, planning, impulse control, concept formation, abstract thinking and creativity. Dallas, Kaplan, and Kramer, 2001. It may be administered individually or on a group. It is a standardized measure to assess executive functions in children and adults between age range to 8 to 89 years. The sixth test we have digit span test. Initially, this test was part of WAIS, which was Vaxler. Okay, WAIS was Vaxler Intelligence Scale, or adults. It was for adults, which was 3. The aim of test is to measure an individual's working memory and assess any impairment. Working memory assessment. And the seventh test was Wisconsin card sorting test. Wait, this is called card sorting test, and it was a neuropsychological test of set shifting. I hope it's visible. It was set shifting, and okay, so where were we? It is used to assess frontal lobe dysfunction in patients of brain injury. Frontal lobe dysfunctions in patients of brain injury. Okay, and next we have schizophrenia or any other mental illness, which is very common. Schizophrenia. Okay, the participant has to sort 64 cards to match either with color, form, or number of figures, and the participant is not explicitly told the rule but must refer it from the feedback received from the person administering the test. Okay, then the eighth one, yes, it is the eighth one, which is dichotic. I don't know what is this. Dichotic listening test. Dia. Here it was a diachotic. Little two ear. Dia means toe and cortic means ear. And otic means ear. Is non-invasive test initially used to investigate selective attention, but later used to assess hemispheric lateralization of language ability. For the hemisphere lateralization of language ability. In the standard dichotic listening task, the participant is simultaneously presented with 2 different auditory stimuli through earphones. Based on the instructions given by the experimental, results are concluded for the test. So these were all the neuropsychological tests. Okay, research ethics in biopsychology. So this was the topic, and next we will continue with the next. Thank you.